So we have a sexual assault investigation, and the legal term is rape. Then we have our prayers. Then we have the outline of this sexual assault investigation. Then rape is traditionally referred to as forced vaginal penetration of a woman by a male assailant. Now it is a gender-neutral term, sexual assault. And the legal definition is any genital, oral, or anal penetration by a part of the accused body or by an object using force or without victim's consent. And criminal sexual assault is often further stratified to include acquaintance rape, date rape, statutory rape, sexual abuse, child sexual abuse, incest. Okay. Acquaintance rape refers to sexual assault committed by someone known to the victim, frequently a date, teacher, employer, family member. And incest. The perpetrator or the assailant is related to the victim. A family member, legally barred from marriage, like cousins, step relatives, yung mga one parent married in another person but brought with them in the household their sons or daughters. Okay. Parental figures living in the home. Yeah. So what we are saying is that date rape occurs within a dating relationship. So the classical one, decades ago, 100 years ago, it's a one-on-one date, but it is no longer the social norm. Today we have a dance, a party, or another unsupervised group activity, junior, senior prom, okay, sa schools, kaya yung mga outing ng mga estudyante, yan, sa beach, mag-iinuman, yan. Pag nalasing, something like that happens. Then we have statutory rape. Those with done on females under the age of 12. And it's updated now, I think, in the Philippines. Our reference book is Legal Medicine by Olarte, volumes 1 and 2, and this is a volume 2. Okay. Next. So what we are doing today is a sexual assault investigation done by a medical practitioner. Okay. Because whether the investigation of a sexual assault is done in a hospital or a PNP station, NBI station, Commission on Human Rights office in the hospital, it is done by a medical practitioner unless there is a nurse practitioner in the absence of a medical practitioner. Most probably the medical practitioner is away on a mission or something like that. But the conduct of history and physical examination should be properly documented and signed by the medical practitioner. And this nurse practitioner should be certified and trained in sexual assault investigation and physical examination. Okay. Now, there is a thin line separating an MD and a forensic pathologist, a forensic medicine practitioner's view of sexual assault. Both employ procedures of investigating an alleged sexual assault case. A private MD may not be interested in a sexual assault case. Because in the first place, it is not his duty to do a sexual assault investigation procedures, and he cannot appear in court appearances usually for reasons na like security. Pwedeng ma-threaten yung private doctor, or not being paid for his efforts and services, security issues, concerns, not enough experience handling sexual assault cases. So, as binanggit natin kayo na, threats and other more reasons. Now, the sexual assault victim versus a sexual assault survivor compared, what we have here is that the victim is a weak person versus a survivor who has the guts and pride or something like that, or the capacity to expose who the perpetrator, okay, to tackle his predicament, albeit the long-term effects of the experience. Yeah. A sexual assault survivor may have post-traumatic experiences or signs and symptoms following the sexual assault incidents. A sexual assault victim, what he or she can do, or in between he or she, yung mga intersex, is a week yung tatahimik na lang. So that's why they are labeled as victims. Okay. Of course, if the victim, a true victim, is the one who has died due to a fatal sexual assault incidents or crime. See? So, in the investigation, the personality of the assailant or a perpetrator is considered, and one of the characteristic of a perpetrator is the one who wants power and control, not a sexual motivation. Okay? Assailants display anger, violence, hostility, and aggression. And this view is in a book by these two people in 1977. But in 1997, it was recognized that their power over the victim is more satisfying than the sexual act. Okay. Next, what is the triple role of an MD? So we have medical concerns, injuries, diagnosis and treatment, emotional state of the survivor or victim, short and long-term support, legal role, interpreting evidence collected, especially when the case filed by the survivor or the victim prosper in a court of law. So the doctor naturally will be testifying in a court of law. Okay. Sometimes these three roles are in conflict. Why? Because some serious medical conditions may preclude the collection of specimens for legal purposes. Like what? Say there is some bleeding in the anus of the sexual assault survivor or the genital organ. What would be first tackled is the injury of bleeding rather than interviewing the survivor or victim in the emergency room. Okay. Naintindihan ba yon? Hello?
Opo.
Okay. So, the most urgent o yung mas priority sa isang incident of sexual assault takes place in the investigation or in the procedural steps in treating a sexual assault survivor or victim. Okay. Now, just in any case, kagaya ng investigation ninyo sa, say, in a criminal investigation, sa scene of crime investigation kay Ma'am Yam, you should know what is going on pagpunta niyo sa crime scene. So, at least may inkling kayo what is going on. Although in some cases, sa mga widespread emergencies, kagaya ng natural disaster, yung mga shooting cases, accidents, alam na ninyo na what would be taking place per se. But further investigation into the causes of those incidents will tell you that those accidents were not accidents at all. They were, say, staged, or what do you call it? There was an intention to have an accident. Okay, so there was some sort of a criminal offense. So if there are fatalities, it could be, when the cases reach the court, could be homicide or murder. Okay, so in the sexual assault investigation, what paramounts first is the taking of the history, HX, conducting the PE, yeah, physical examination. Management differs from the routine doctor-patient relationship. Okay, so in the ordinary doctor-patient relationship, you will collect evidence from the survivor or victim that, in view of a future case that can be filed in a court of law. So, while investigating the person who has experienced a sexual assault, the emotional needs of the woman is paramount. So, itong woman na to, palitan natin, pwedeng man or yung intersex, yung a person with a female and male sexual organs on the body. Ayan. Hindi natin masabing his or her body. Okay? But depende sa outward appearance niya, he could be looking like a man, but the mentality is that of a woman, or vice versa. The woman looks woman, but the mentality is that of a man. Okay, so the examination room should be quiet, private, and conducive for evidence collection and taking of pictures. Okay, for evidence. Okay. Now, sexual assault survivors, okay, or a victim should be believed. Sa lahat ng sinabi niya, dapat i-take note ng nurse practitioner, o doctor, recorded, okay, to be listened to, and hindi mo pwedeng kalabanin yung survivor. Basta nagkukwento yung survivor, take note what have been divulged to the practitioner, medical practitioner, nurse practitioner. Okay. Next, the history taking. Okay. Just like we said earlier, pre-existing medical conditions should be tackled first. Kagaya ng mayroong bleeding sa anus or vagina ng woman, sa anus ng male or female sexual assault survivor or victim. And what are the prescribed medications that the sexual assault survivor was taking? See? Why? Because she could be taking or he could be taking a medication that, although he had this serious incident, he has no memory for something that had happened to her or him. Okay? And there was a history of illicit drug use. Yan ang mga common questions in the back of the mind of the sexual assault investigator. Yung mga nagtitake ng mga stimulants, kagaya ng methamphetamine, yan, etc. Or the sexual assault survivor, SAS, has a previous history of child abuse or sexual assault. Okay? So those who having previous history of sexual assault, like child abuse, they tend to be psychologically or emotionally unstable. They would like to have the abuse be repeated. That's why they like to stay in the dark parks, kagaya na sa Luneta or saan, sa Laurel Park, to have a repeat experience again of sexual abuse. Meron ganyan. Okay. Next, sexual assault survivors, SAS, need to be supported. You validate their experience. Okay? While doing the examination, there should be a privacy and safety. Okay? Wala yung assailant doon sa room, or yung assailant ay nakakulong na. Okay. Now, the SAS ay dapat magkaroon ng control whether she would or he would or he or she would have a physical examination, and that she can or he would have a physical examination and be subjected to investigation. Okay? So, pwedeng sabihin niya, bukas na lang ako bumalik kung magbabago isip ko. Or after the physical examination and taking of history, sabihin niya, hindi po ako magdidemanda. Okay? Confidentiality. Everything that has been taken place, taking the history or something, is confidential. Okay? And private. Just like in a doctor-patient relationship, lahat ng nakuhang information on doctor or investigation should be a confidential thing. Okay? Unless na they would like to make it public kung magsasampa sila ng kaso via the prosecutor's office or sa police. Okay? So there must be respect. Alam na ninyo ang meaning ng respect. Okay? Avoid the use of word rape as it is not a medical term but a legal term. Okay? Okay ba yan? Hello?
Yes po, Doc.
Okay. Next. While taking history, lahat ito dapat makonsider. Was there a violent contact as in punching, hitting, use of weapons, drugs, alcohol, yan. Whether condoms are used or what? And details of the sexual contact. Yan. Use of penis, digital or object penetration, oral or anal intercourse, as well as documentation of any ejaculation, urination of the assailant or perpetrator. Okay. Number of assailants, age, and identify information for each assailant, date, time, location of the alleged assault or incident. Yeah. Just like you do in crime scene investigation. What you have learned in the last semester. Okay. Next. Ano ang mga ginawa ng victim after the assault? Nag-change ba siya ng clothes? Naligo? Naglabati ba? Uminom? Or kumain? Nagsipilyo? Umihi? O dumumi? Or other sexual contact? Ito lahat ito will modify the evidence that the medical practitioner or forensic science practitioner, kagaya ng PNP sa NBI, Commission on Human Rights, sa mga hospital, whatever they could be able to collect, okay, will be modified by this. But there are associated data on how they can be modified, which will be able to tackle as we go along on the group reports. Okay, so for females, gynecologic history, the last menstrual period of the woman, contraceptive use, pregnancy history, last sexual encounter with a husband or a boyfriend, or any recent episode of gynecologic infection and pelvic surgery, and time in history of physical examination. Kailangan yan. Ma-document. Yan. Yeah. So, why last menstrual period? Kasi yung sa male-female sexual assault, she could be assaulted and she might be in the fertile period. If she uses contraceptives, although she is fertile, the contraceptive use might prevent her being pregnant. And if there's a pregnancy of the history of the female victim. Okay. So, nagkaroon siya ng sexual assault today, but last night, she had someone with, and they did a sexual intercourse that will make things, difficult or complex. Any recent infections in the genitourinary tract, gaya ng syphilis, gonorrhea, or any pelvic surgery. Yeah. Basically, this is a medical history, but they help in the overall evaluation how a sexual assault investigation takes place. Hey, next. SAS often feel very fearful undergoing a physical examination. So, during the process, make her feel in control of the procedure. And she may or he may like that the procedure be stopped or continued next day or maybe next week, but mas malayo yung PE from the time of incident will make the evidence collection and interpretation difficult. Okay, so the choice of a female doctor would be respected by a male duty medical practitioner sa place na examination. Yung ibang babae, gusto ng babaeng doktor. Yung ibang lalaki, gusto ng lalaking doktor. In between, mahirap kung merong he or she medical practitioner doon. Dahil ko konti lang ang tunay na merong he or she. Okay. Medical practitioner. A relative or friend should be present at the time of the physical examination, especially the survivor is a minor. Yung mga batang maliliit, mga babae, lalaking maliliit, kung walang tatay, walang nanay sa lugar na iimbestigahan, hindi mo ma-examine dahil they will not allow you unless a relative will allay them. So, prepare the explanations of what will happen and progress during the entire PE. Dapat ini-explain din sa survivor. Sabihin mo, ang susunod nating i-examinin mo ay ang iyong breast. Payag ka ba doon? Pag pumayag, okay, sige, you proceed. Ang susunod nating examinin ay ang iyong puwet. Okay. Payag ka ba doon? Pag pumayag, okay. Pag susunod ang iyong ari. Pag pumayag, okay lang. Okay. Pag sinabi niyang hindi, okay din sa investigador or doktor. Pero that will hinder the evidence or the physical examination would be incomplete. Just explain to the SAS that kailangan natin yan, kailangan natin to. So the twofold purpose of the PE is to assess for physical injuries and collect evidence. Dahil tuwing merong ganyang mga kaso, mas malamang na makakarating sa husgado yan. Okay. So, valuable evidence may be gathered from the clothing of the woman. Wag lang nalabhan. Ayan. That's why you ask the woman if nilabhan niya yung damit na suot niya. Yung blouse, yung palda, yung kanyang brief, bikini, or what. Okay? Up to 1 month. Yan. Kung hindi nalalabhan. Only the woman can handle her clothing. So, why? Sapagkat pag may ibang humawak doon sa damit niya, baka malipat doon yung DNA ng handler ng kanyang mga clothings. So, this clothing should be placed in a paper bag so that they can breathe and will not gather moisture and bacterial growth. So, alam ninyo yan, how to handle evidence. If a woman presents immediately after sexual assault and has not changed clothing or not showered, she can undress on a sheet of newspaper and anything that falls can be collected. Okay, so tatayo siya sa newspaper. Ilang newspaper na papel doon sa sexual assault investigation kit. Usually contains a paper where the woman would undress, remove clothes, so that anything that falls on that sheet of paper will be collected. Okay. So, during physical examination, was the patient conscious? Ano ang demeanor niya? Ano itsura niya? Yung tulala ba? O hindi na yung mukhang hindi nasyak sa nangyari. Yung parang tutuwa-tuwa pa, parang ngingiti-ngiti. Demeanor, yung barabang kausap mo, ayaw tumingin sa'yo. Okay. Yung ang appearance ay parang sa Tagalog, sira ang ulo o what? O nasira ang ulo gawa ng incident or dati nang sira ang ulo. Yan. So, appearance. Okay. Saan ang appearance niya? Sibil ba mukha? Okay. Gusot ba ang mga damit or what? Coherent. Yan. Pag tinanong mo, anong pangalan mo? Yan. Can answer easily. What day is today? August 30. Okay. Pag sinabi niya December 30, the survivor is not coherent. Okay. Nasaan ka ba ngayon? Nandito po ako sa Saudi Arabia pero nasa Pilipinas kayo. Okay. So, the survivor is not coherent. Okay. Speech. Slurred ba? Yung parang lasing o mabagal ang salita? Pag mabagal ang salita at amoy alak, mas probably lasing. Merong alcoholic breath. Yan. So, do physical examination and orderly passion. Yung unahin mo muna yung hindi siya magugulat. Kaya na. Patingin nga ng iyong mga daliri. Okay? Patingin nga ng iyong braso. Patingin nga ng iyong kilikili. Tenga. Pwede ko bang tingnan ang iyong bibig? Yan. Pwede ko bang tingnan ang iyong breast? Pwede ko bang tingnan ang iyong singit, ang iyong puwet? Tapos kahulihan, yung genitals niya. Okay. Okay ba? Naintindihan? Hello?
Opo, sir.
Hindi pa kayo inaantok or what? Nasa kalahati pa lang tayo. Next. Ayan, yung perineum. Dapat alam ninyo yung anatomy ng female and male genitals. So what is the perineum? Tatanong natin yan sa activities nyo. Introitus. Yan. Posterior forceps. Hymen. Yan. Yung hymen, alam na yan ng karamihan. Pero yung mga posterior forceps, introitus, perineum. Sa Tagalog yata ang perineum pondilyo. Okay? Buttocks. Pigi. Anus. Yan, yung tambucho. Okay. Speculum. With warm water for lubrication only. Kasi water lamang. Otherwise, you will dilute or contaminate the fluids inside the vaginal walls if the woman is the survivor or victim. Vaginal walls, anong klase, anong itsura, kung namamaga o bloody or something, leeg-leegan, kung may laceration o kung ano, okay? So, sexual assault may not cause any genital injury. And important to remember that many women who have consensual sex can have small grazes or fissures at the posterior forceps ng vagina. Okay? Next. Have consent to take photos of the genital injuries, and if denied, take diagrams and note size. So, pag kukunan ng picture, magpapaalam ka rin. Kukunan ko ng picture yung ari mo. Okay? Pwede ba? Okay. Sasabihin sa iyo ng survivor. Opo, teka muna. Patatawanin ko muna para maganda ang pose. Okay ba yon? Naintindihan niya? Hello? Hello? Hello?
Yes po.
Okay. So, it's important that contusions may take 48 hours to be visible. Bawa, sinabi ng survivor, sinuntok niya ako doon. Pero pag-examine mo, wala pang pasa. So, pwede mo siyang pabalikin considering na if she can return so that pwedeng kunan ng picture or for documentation. Okay, so we learn from forensic medicine 1, what are the contusions, lacerations, hematomas. Okay. Pag yung pasa hindi kaagad lumilitaw, it's usually 2 to 3 days. Okay. Lalo na kung may mga taba yung area ng merong contact injuries. Okay. Next, evidence collection. Ano ang specimens to be collected? Okay. Plain cotton swabs, wet with little top water, or normal salt saline, then smeared on a clean and dry glass slide. Both glass slide and swab are air dried. So we have the back to basics of handling pieces of evidence, transport to the forensic laboratory, properly labeled, chain of custody, yung container properly labeled, Okay, so make sure that the pieces of evidence reach the laboratory using the facility of chain of evidence, yung mga signature, kung saan, anong oras, anong araw. Okay. Now, swabs taken from the areas that have been directly involved. Okay. Sa lalamunan, sa ears, sa oral cavity. Okay. Oral cavity should be done if oral penetration took place, or the oropharynx for gonorrheal testing, and mouth for seminal fluid. Sperm should be recorded from the cavity up to 6 hours after the assault, even if the teeth are brushed and mouthwash was used. Scrapings from the fingernails. Yeah, so you know you should know the reason why you should do some scrapings from fingernails. Pubic hair should be combed. Use a fine comb, yung kagaya ng suklay ni Lola Celia, slowly to collect pubic hair that would be foreign on the pubic hair of the females of woman. Secretions that fool the posterior fornix. Yan, dapat alam niyo yan, ang anatomy. So, we will have some activities that will show, you will show where is the posterior fornix and posterior force, where you can aspirate secretions, whether saliva, blood, or seminal fluid, or sperm. Okay. Next, in some cases, the survivor may be infected during the sexual assault. So, the transmitted diseases may be tested as evidence if the assailant has a sexually transmitted diseases. So we use cervical swab. Although these swabs are expensive. Yeah, let me just chlamydial swab yan. Gonorrhea, trichomonas, HIV, blood tests or serology, hepatitis B, C, syphilis, and pregnancy tests if the woman says she is pregnant or not pregnant, as a control, just in case in the future, after 6 months, she would say she got pregnant because of the sexual assault. Yeah, although they are expensive, I do not know if they are ordinarily done again, BNP or NBI. So if she have STD, dapat bigyan ng gamot. So, follow-up should be done weeks after the physical examination. Lalo na kung pregnant nga yung woman. Okay? So, emergency contraception is offered if the woman were not using contraception and she was fertile during the time of incident. So the most effective form is levonorgestrel in first 72 hours or intrauterine device can prevent pregnancy 5 days after assault if the female is not a virgin. The use of IUD is not advisable. So follow-up is crucial and repeat urine pregnancy test 2 weeks after her next LMP or approximately 6 weeks after assault. Next, medications and prophylaxis. For gonorrhea, we have ciprofloxacin, ceftriaxone. Chlamydia infection, azithromycin, doxycycline, amoxicillin. It's a pity those women or ladies or females having had sexual assault and infected by sexually transmitted diseases. Some of them are not rich. Some of them are ordinary people in the streets. Sometimes wala ngang pagkain na pambili. Bibili pa ng antibiotic. Aba, hindi na yung makakakain. So, during our time, usually, pag pinababalik namin yung nagre-reklamong tunay, pwede ba bumalik kayo? Wala po kaming pamasahe. Pwede bang bumalik kayo bukas? Wala nga ho kaming pamasahe. Kaya bibigyan pa namin ng pamasahe yung mga tao. Yung tatay o nanay o yung lola, pati yung survivor. Abay, minsan, pag sinabi mong bumalik, pamasahe lang o bibigay nyo. Paano pa kung nagutom kami? Malayo pa yung biyahe. Aba, hihingi tayo sa second year class o third year class ng Lyceum of the Philippines para makapunta kayo dito at meron kayong pagkain. Okay ba yun? Hello?
Yes po,
Hello?
Doc.
Okay. So, bibigyan natin sila ng pamasahe. Okay. Next. Recommended serology, yung blood test post-sexual assault. For hepatitis, we have hepatitis B virus, vaccine, or immune globulin. Immune globulin, mahal yan. Miski nga itong virus vaccine ay nasa 1,000 na nga yan kung magpapa-injection ka. Lalo na itong immunoglobulin. Last resort na ito. HIV, Retrovirus. Yan. 4 weeks pa. Paano na yung mga taong walang pera? Ito, 4 weeks, 2 times daily. Yan. So, nakakaawa. Dapat talaga sa mga Women's Day sa PNP, sa NBI, o sa mga ospital, merong DSW people doon na sumusuporta sa mga sexual assault survivor or victims. Ewan ko kung ginagawa nila yan. Pero for myself, dapat ganon ang gawin. Para makabili ng, say, kakailanganin ng mga na-involved, lalo na yung survivor or victim. So maraming dapat gawin ng gobyerno sa ganyan. Okay. Next, sequelae of sexual assault. Acute stress reaction. Nagiging panicky. Yan. Tulala. Yan. For example, PTSD. Natutulog, biglang magigising. Dyspareunia, pag nag-asawa, nahihirapang magkaroon ng sexual intercourse sa asawa. Pelvic pain. Sabi, masakit daw ang balakang. Irritable bowel symptoms. Yung iba, tumataba dahil kain ng kain dahil sa stress. Premenstrual disorder symptoms. Alam yan ng mga babae. Yan. Migraine headache. Yan. Although tapos na yung nangyari, nakulong na yung tao na assailant, they will develop headache. Lalo na kung hindi pa nakukulong yung assailant. Fibromyalgia, yung masasakit ang mga katawan, wala naman trangkaso. So, how about a child or male survivor of sexual assault? Yeah. Yan ang hahanapin natin kung anong mga sequelae. Yeah. Next. So, the take-home message. If any questions, meron bang questions? Hello. Hello.
Wala naman pong question, sir.
Baka inaantok na kayo. So, in summary, take-home message, role of an MD is to assess and treat all injuries, collect forensic evidence, identify and prevent STD, assist in preventing pregnancy, minimize psychological sequelae, acquire women's consent, building trust, confidence when doing examination. After sexual assault, many women suffer acute stress reaction, which may persist. So, over time, PTSD. Okay? So, yan yung gagamiting ang tawag dito, diagram for recording everything aside from photography. Okay. So, pagkukunan mo ng picture tong injuries, first, take a picture, pag pumayag yung survivor, then put a number and scale, yung kagaya ng ginawa natin Sa mga baterya, double circle at saka coin, meron dapat scale. So, you have three pictures in one evidence picture. Okay? Next meeting, siguro mga first hour, I will discuss how medico-legal report is being done. Okay?